We will get started here in about 30 seconds. Thank you. All right, it is about 30 minutes past the hour, so we'll go ahead and get started. Welcome, everyone. My name is Colin Evans, and I'm part of the business development team here at Baird. On behalf of your Baird advisors, I want to thank you for joining us for today's webinar, Baird Wealth Strategies webinar, Navigating the Medicare Maze, Making Sense of Federal Health Insurance. We're thrilled to have you with us. In this webinar, we have two of our esteemed planners who will help demystify some of the complexities of Medicare planning. First up, we have Ron Johnson, a wealth planner who has been in the business for 29 years. He resides in Whitefish Bay with his family. We also have Matt Urbanek, a wealth planner who has been in the business for 18 years. He resides in New Berlin, Wisconsin with his family. These two planners are part of our broader wealth planning team who are regionally aligned to assist our advisors in delivering the best advice through quality, holistic planning engagements. But before I turn the call over to Ron and Matt, I have a few housekeeping items I'd like to highlight. All participants are in listen-only mode, but we'd love to hear from you. We will host a Q&A session at the end of the call to address as many questions as time permits. You can submit a question by clicking the Q&A icon. Please be sure to address your questions to all panelists. This presentation is being recorded and will be available along with the slide deck through your Baird financial advisor about a week following today's call. And with that, I will go ahead and turn it over to Ron Johnson.
Thanks, Colin. I appreciate it. Well, I want to thank everyone for joining the call today. And my guess is the reason you have joined is your mailbox currently looks like this. So we know starting around age 63, Medicare Advantage companies start inundating you with mail. And we know that probably creates a lot of confusion, probably adds to the anxiety of Medicare. You know you need to do something, but you don't necessarily know when you need to do it or what you need to do. So that's the purpose of this call, is to be your guide, so to say, as we go through the Medicare maze. Now, we like to use the word maze, but it's really not. And the purpose here is to really bring some clarity to it. It's really a fairly simple program, and I can assure you that millions before you have navigated it, and you will too. So let's go ahead and dive into it. So when I think about Medicare, this is actually how I think of it, and Matt would probably say the same. We think of it as there's components of what the government provides, and then you need to purchase something that the government does not cover. So what are the options for additional coverage? Then probably the most important concept we're going to talk about today is how and when to sign up, because that's incredibly important, and we'll get into why as well on that. And then finally, we'll have a few items that we'll talk about that adjacently related to Medicare that are important to understand as well. So why don't we go ahead and dive into what the government provides us? Okay, so there are three parts we want to talk about here. So part A is everything that happens to us in the hospital when we're admitted to the hospital. Part B is everything else, so all of our outpatient care. And part D is the stuff that we take to prevent us from using part A, prescription drug coverage. So let's dive into these. Let's start with part A. Okay, so part A, as I mentioned, covers everything that happens in the hospital on an inpatient basis. So what that means is anytime you're admitted to the hospital, if you're there under observation or for tests or for other things, that's part B. We'll talk about that in a minute. Part A also steps in and covers the skilled nursing care that you need to rehab what brought you to the hospital in the first place. Maybe you broke your ankle and you need to strengthen it after it's been repaired. So part A covers that. There's also extensive coverage for behavioral and mental health services under part A. And finally, it's Part A that steps in and covers hospice care if we need that. Now, I use the term good news here. I'm not thoroughly convinced that's true, but there are no premiums associated with Part A if you've been working in the United States for at least 10 years. So you qualify for Part A in the same manner that you do for Social Security. Every time you earn roughly $1,500 in a given year, you get a quarter. And you can earn up to 40 quarters or 4 quarters in a year. Work 10 years, you have 40 quarters, and congratulations. You now have Part A, or at least eligible for Part A. And you pay for it through the FICA tax, which of the 7.65% of FICA tax that you pay, 1.45% of that covers Part A. If you're self-employed, we do have bad news for you. You'll pay both ends of that. Sorry to be the bearer of bad news. So no premium here, which is great. But if you have to use the system, if you have to go to the hospital, there's a deductible here. And in 2025, the deductible is $1,676. And that's per benefit period. Now, this is different than what we're used to while we're working with a calendar year deductible. So Matt and Colin will tell you that I love to tell stories. So I'm going to tell a story to help you understand what a benefit period is. So this is my little dog Jellyfish. Now he's 12 pounds, but he's all muscle. And let's assume I'm 65 years old and I've got to take him for a walk. Now Jellyfish gets excited, he pulls on the leash, and I trip over the sidewalk and break my ankle. Now I call my wife, who screams around the corner in the SUV, scoops me up, and takes me to the emergency room. As soon as we go through the doors, we'll write a check, figuratively, for $1,676. Now they will take me back, they will fix my ankle, and that will be my only cost. Now let's assume that my ankle is all better and I'm leaving the hospital on crutches. Matt will tell you that I'm not very coordinated, and he's right. And upon exiting the hospital, I trip over the curb on my crutches and break my wrist. Now my wife admonishes me, scoops me back up, and we go back through the doors and write another check for $1,676. So the benefit period is simply the period it takes to fix whatever brought us there in the first place. Now, I can stay in the hospital for up to 60 days. And as I mentioned, the only cost I will have is the deductible, $1,676. Now, if I have to stay longer than that, maybe it's something serious, a car accident, got to look both ways, crossing the street, maybe stroke, something like that, I'm going to pay $419 a day for every day beyond 60. And I get up to 30 days in this period. And if I'm still in the hospital, I get another 60 days. Now, these 60 days are not per benefit period. These are called lifetime reserve days. So I get 60 days in my life. And once I use them, they're gone. And oh, by the way, your co-insurance payment will double. So in 2025, it's going to be $838 a day. If you blow through those, that's the end of coverage. But Matt and I are not here to scare you. This is why we're going to purchase something to cover what Part A does not. Okay, so let's move along. So that's Part A. Like we said, we're going to try and keep this simple, not make it a maze, but make it easy to understand, put in small digestible bites for you. Okay, so Part B, outpatient care. Now this is, I said everything else, and it is. So everything that happens when you're not admitted to the hospital. So if you go to the hospital for tests, if you go to the hospital to see a specialist, if you go see the doctor, if you go see any kind of specialist outside the hospital, it's Part B that steps in and covers that. Now, Part B, we haven't paid for yet. In 2025, it costs $185 per month per beneficiary. So married folks, you'll pay $185 times 2 per month. Now, you may pay a little bit more on top of that. So we have to talk about IRMA. Now, not her, but this IRMA. We're talking about income-related Medicare adjustment amount. Now, if I was in charge of Medicare, I'd call it something completely different. I would call it MMPM. Make more, pay more, because that's exactly what this is. So if we look at this chart in 2020, well, in 2023, and we'll talk about that in a second, if your income in 2023 was over $212,000 and you're filing as a joint filer with your spouse, you get to pay more. $74 a month plus the premium for a total of $259. If you make more, you pay more, MMPM. It makes more sense to me than IRMA. So we can go up to a total of $628 per month per person if you're having a really good income year. Now, I mentioned 2023. That's an important concept to understand here. So in 2025, it's what we earned in 2023. So off of our 2023 tax return determines what our premiums are in 2025. Now, income is specifically defined here. It's AGI, adjusted gross income, plus we're adding back our tax-free interest. Okay. Now, one of the things that we do at Baird when you're working with your financial advisor is we're very aware of the IRMA hurdles, and we incorporate that into your tax plan. So we're going to understand, for instance, if we realize income in 2025, that it may or may not impact your premiums in 2027. But we'll have discussions about that with you. Looks like income this year is $240,000. Congratulations, you made more. You'll pay a little bit more in premium. Now, with IRMA, we have one more arrow in our quiver. So CMS, the Centers for Medicare and Medicaid Services, understands that life changes. And they're the ones who sets policy for Medicare. And you have the ability, as circumstances dictate, to appeal if you're impacted by IRMA. Now, normally, Matt and I like to joke, usually if you use the word federal government and appeal in the same sentence, you also have to add the term fleet of attorneys. Well, it's not so in this case. So with Medicare, CMS sets policy, but actually the Social Security Administration is our traffic cop here. So we go to the Social Security Administration to accomplish things related to Medicare. They're our communication piece. So we can simply go to the Social Security office and pick up form SSA-44. Stands for Social Security Administration Form 44s. And we'll fill out some basic identifying information, check the box that applies, and maybe attach some proof of the change of income, and likely our appeal will be granted. Now, what they're looking for here are life-changing events. You were working in 2023, you have since retired, now your income's less because you don't have the income associated with that. Maybe you got a divorce and your income's different. You may have sold a business and you no longer receive income from the business. Now, the capital gain from the sale of the business is not typically something we can appeal. But Matt and I will tell you, it never hurts to appeal. We would prefer to see you appeal and get denied because there's no penalty to do so, as opposed to just assume that you're not going to qualify for an appeal. All right, enough on IRMA, as much as I love her. All right, now with Part B, now that we've paid for it, when we need to use it, we're going to have a deductible here. Now, Part B was not nearly as creative as Part A, and they simply have a calendar year deductible like we're used to dealing with. $257 in 2025. So the first 225 or $2,057 of expenses that we're going to have in 2025, you'll pay out of pocket. And then you're going to pay 20% of every bill thereafter. So that's how Part B works. Oops. All right. So there you go. There's Part A, hospitalization. Part B, everything else. Now let's talk about Part D, prescription drug coverage. Now, I like to lump this in with the part that the federal government provides. But the real answer is not really. But the reason why I put it here is because they put all kinds of bumpers and rules in place to manage Part D policies. So I included it. So when we're looking at a Part D policy from a provider, the most important document that we're concerned with is called the formulary. And the formulary simply tells us what drugs this policy covers. Very important. That's why if you go talk to a health insurance agent, the first question they're going to ask you is, what are you taking and how much of it are you taking? They want to make sure that they can match up a Part D policy that covers what you're taking. And then they're going to look at the different tiers on the formulary to see how much it's going to cost to cover that drug. If it's a cheaper drug or more expensive, the formulary will tell us that. Now, Part D, we haven't paid for that one yet either. So we're going to have premium here as well. Now, premium is going to vary depending on the provider and your location. But I can tell you that across the nation in 2025, premium is roughly about $45 a month per person. And yes, IRMA is back. If you were lucky enough to qualify for Part B IRMA, you get to pay more here as well. Again, make more, pay more. It's not quite as expensive. It starts at $13.70 per month per person if you go over the $212,000 threshold, half if you're a single filer, and up to $85 a month per person plus the premium. Okay. Now this is where we've seen significant change with Part D. In 2024, there are 4 phases to Part D coverage. Those are all gone. I won't even talk about them, even though that includes a donut hole, and I used to love to talk about donuts, but I don't get to do that now. Instead, we're simply talking about a deductible, which in 2025 cannot exceed $590. Then you will pay 25% of every bill thereafter. And bill meaning when you go to buy the drugs you need, you'll pay 25% copay until your total out-of-pocket spending for the year reaches $2,000. So that's the $590 deductible plus the 25% of cost of drugs. Once you hit $2,000, you're done for the year. Congratulations, you are now 100% covered for the rest of the year. And that's all there is to this. So what that means is out-of-pocket maximums are essentially $2,000. And what that means is last year in 2024, we had out-of-pocket maximums of somewhere between $6,000, maybe $8,000. It's a big difference if you're managing a prescription drug policy, if you're the provider. So one of the things we're seeing this year in open enrollment, and now we'll talk about open enrollment here in a little bit, is premiums are going up, sometimes as much as 3 times, or providers are just exiting the marketplace. So remains to be seen if the federal government will change this again or not. We don't know. But that's what's going on. That's Part D. Okay. Covered that. So now we covered Part A, we've covered Part B, and we covered Part D. Now we have to talk about what we need to purchase to cover what those things don't. And at this point, I want to tag in my colleague, Matt, to go ahead and take this presentation further. You're going to be in good hands. Matt, it's all yours, my friend.
Tag it in. Appreciate the opportunity to join. So As Ron so aptly said, the base of our Medicare plan, Part A, Part B, Part D are the core tenets of what you see provided by most Medicare plans. A and B is the base, Part D is an additional premium, although D is optional. I really question if it should be optional, but it is optional. You don't have to sign up for a Part D plan, but Part D, Part A, Part B, part of the base plan. When we talk about coverage, as Ron was talking about Part A, some of those per day costs, some of those deductibles, those co-pays, that 20%, that tends to lead to a lot of what we call gaps in coverage. And so oftentimes on top of your base Medicare plan, you will also want to either get a supplement or a gap policy, same thing, same word, supplement, gap policy, or alternatively go through a plan provider, a private insurance company, and go with an Advantage plan. So we're going to talk a little bit about the difference of the two and how they operate in the scale of the Medicare world. So talk a little bit about Medicare Advantage. As Ron so aptly showed you, those mailers that you saw filling up your mailbox, these are likely all coming from different Medicare Advantage plan providers. They are private insurance companies. They have a in-network care, much like your existing health insurance. If you have it through an employer plan, it's usually some form of a PPO, HMO, sort of a managed network of providers. With that being said, when you think through any core group of health insurance, whether it's self-funded or whether it's through an insurance company, the goal is to keep as many people as healthy as possible so that we can keep the costs down. So you're going to see Advantage plans bundle the existing premiums of A, B, D, and then they kind of add some sweeteners in there. Not donuts like donut holes, like Ron was talking about with prescription, but sweeteners like vision and dental, hearing, gym memberships. Oftentimes, you'll see things like chiropractors that may not be covered under the original Medicare plan. So Medicare Advantage is its kind of whole other separate, packaged, bundled policy. So sometimes you hear the bundled versus unbundled. The Advantage plans are those bundled packages from insurance providers. You'll oftentimes, you'll see the celebrity endorsements of the Advantage plans running nonstop, as we'll get to today. Starts the annual enrollment period for Medicare. So I'm sure you'll start to see more and more commercials on Medicare Advantage plans. Again, you'll oftentimes see things like no copays or no premiums or all these other things. Worth noting that when you look at a Medicare Advantage plan, a no premium Medicare plan is usually no additional premium. And what I mean by that is that the government directs your Part B premium, your $185 or up to your $650, whatever you're paying with the IRMA costs, whatever you're paying is being redirected to the insurance company, who will then provide you their in-network Advantage plan. As I mentioned, they're all-inclusive, they're bundled, they have some of the additional, kind of value adds in there. The other side of it is oftentimes you are limited to that network. So you may not be in network for certain providers that you want to be able to visit. So an important aspect here of going an Advantage plan route is making sure you understand the coverage area and the network that you would be signing into. Oftentimes you see large providers, your Aetnas and your United Healthcares having Advantage plans who have really large networks. Sometimes, depending upon your region and where you are, you maybe only have one or two providers there as well. So thinking of that way, Advantage plans are really kind of a packaging of all of the different plans into one. Some of the more platinum packages will have additional costs. Other ones just basically take your $185 from Part B and redirect to it. So I always kind of talk about gap plans as an additional way to get coverage. I wanted to talk about the Advantage plan first because it's sort of its own thing, but gap plans are how you get additional coverage in the base Medicare. So Advantage plan was kind of, you're going outside of the base Medicare. Medigap is, or supplement policies are supplementing on top of the base Medicare. We're away from private insurance companies. We're away from kind of packaging it. We're back into the more unpackaged, unbundled approach here as well. So the Medigap is a supplement to Part A, a supplement to Part B, Part D. So when we think through, usually Medicare facilities, Medicare is usually pretty much accepted. I would say that 95% of healthcare institutions pretty widely accepted. When you go to the Advantage plan, they may not accept the Advantage plan in network, so you might end up paying more. A gap policy, because it's built on top of the existing Medicare, you're usually able to use it in a pretty much a broader sense of broader locations that will accept it. So again, what's covered? We talked about the per day, per cost of Medicare. We talked about those 20% copays. We talked about premiums up to $2,000 for your health care. A gap policy is going to help to cover those out-of-pocket expenses. It starts to put a cap on what your out-of-pocket expenses are. Some policies will cover services that original Medicare doesn't really cover. Emergency medical coverage, and also coverage outside of the U.S. Coverage is determined by the federal government. However, states oftentimes choose to participate or not participate or offer their own policies. 3 states, Massachusetts, Minnesota, and Wisconsin, tend to offer their own supplement plans, and they don't sort of play into the whole federal. Only difference, though, between costs from policy to policy, only difference between carriers is your cost. So what I mean by that, if you take a look at this next page, you'll see A through N on different supplement or gap policies. Leave it to the government that to have Part A, Part B, and Part D as a part of their base Medicare plan, but then you're also going to have a Medigap plan, A or B or a D gap plan. I digress. But when we talk about the different gap policies, on the left here, you'll see the benefits that really are considered the identified gaps of Medicare A, B, and D. You see the costs that generally, if you didn't have a gap policy, you would be sort of out of pocket on your own. And then depending upon how much coverage you want, you can choose to have a gap policy help to cover your out-of-pocket expenses. You're going to pay an additional amount of premium, and it's generally somewhere in the $150 to $200 a month range. They are age-based, so the older you are, that they tend to get a little bit more expensive as well. So gap policies put a cap on how much you're going to pay out of pocket. Just as a kind of reference point, I look at policy G, policy F. Policy F is no longer available to those who are new entrants into Medicare. Policy G, as it covers the most, is the most common Medigap policy. 39% of individuals choose to have a Part G plan because it covers the most out of pocket. So you'll see supplement plans as sort of its own separate costs. So if I compare, again, the Advantage plan route versus the original or the unbundled route, the Advantage plan, you're usually paying one premium. Be anywhere from your base premium of a $185 up to $350 or more. Your unbundled package, you're not going to pay anything for A if you have 40 quarters. You're going to pay $185 or more for Part B. You're going to pay on average $45 or more for Part D, and you're going to pay on average $150 up to $250 or more for an unbundled package. So you're going to generally see a gap plan, sort of the unbundled, may cost a little bit more, but generally you're going to get more coverage and a lower out-of-pocket cost. So the trade-off there, right, is I might pay a little bit more every year for the unbundled route, but on average, I tend to see a lower out-of-pocket cost every year to do so. So that's kind of the comparison of the gap policy versus the Advantage plan, which gets us to, hey, when do I sign up for all this stuff? I'm ready to rock and roll. You guys have given me everything I need to know. I got this 200-page Medicare and You document that I've read 6 times. I'm ready to sign up, right? So initial enrollment begins when you turn 65. This is what's called initial enrollment because it's the first time you're eligible. Very worth clarifying and making sure folks understand. Social Security, retire, you take Social Security at 62, that's the other government program that's funded by FICA. Just because you qualify for Social Security at 62 does not mean you qualify for Medicare at until 65. Additionally, just because your spouse turns 65 does not mean that you can hop on your spouse's Medicare. Difference to what we usually see with healthcare where we can do a family plan, all Medicare policies and enrollments are done on an individual basis. You have to individually achieve age 65 in order to be eligible for Medicare. Again, your initial enrollment period lasts for 7 months. 3 months before you turn 65, the month that you turn 65, and 3 months after. Again, I generally don't suggest waiting after 65 because like this guy, if you miss your initial enrollment period, if you wait outside of that 3-month period when you were supposed to sign up, you'll end up paying an extra 10% for each year that you could have signed up for Part B but didn't. Part D, you're going to pay an extra 1% per month or 12% per year, again, if you miss your initial enrollment period. This is oftentimes, I'm seeing probably questions in the chat, but what if I'm still working? And we'll get to that. That's a different enrollment period. That's called a special enrollment period, which we'll get to here in the next section. So very important that if you're eligible to sign up at 65, again, Medicare wants healthy people in their pool. The more healthy people we can have in Medicare, the lower the costs are. So if you were supposed to be a part of the Medicare pool and you waited until 70, 72, because you know what, you don't have any health concerns, you want to wait as long as possible, you want to gamble on it, well then they're going to penalize you because you weren't a part of that pool. So very important to not miss your initial enrollment period. I generally think of this though as anyone who is not on employer health care or their spouse's employer health care before age 65. Because the exception, the biggest exception, the exception that most people will ask us about is, what if I'm still on my spouse's health care, or what if I'm still working beyond the age of 65? And if you still have credible health insurance coverage, credible meaning usually companies with at least 20 employees are considered credible coverage. If you have credible coverage and you maintain health and drug insurance coverage through your employer, then you get a special enrollment period, which we'll talk to you about here in the next slide. Again, drug plans must also be credible, so you have to make sure that the coverage that you get from your employer is credible if you plan to work beyond age 65. Most medium to large size employers, this is not an issue, but always worth double checking. Want to call out that little asterisk in the bottom. Beware of COBRA or employer provided health insurance coverage. It's called retiree health insurance. The way I like to think of it is if you are paying everything for your health insurance, you're not being helped at all by your employer, COBRA being one of them, and usually retiree health insurance, you're able to stay on the health insurance plan, but you got to pay for 3 years, for 5 years, for however long it is. And your employer is not helping to kind of pick up the tab. Those oftentimes, COBRA for certain, and most times retiree health insurance are not considered credible coverage. So an example here, you'll see somebody who maybe retires at age 64 and a half. They're 6 months before they're Medicare eligible. They hop on COBRA. COBRA usually allows you 18 months of coverage after you separate from service. So if I hop on COBRA at 64 and a half and I say, you know what, I'm going to wait it out the full 18 months. I just really like my employer health insurance coverage. I'm okay paying a little bit more for it. I'm going to wait the full 18 months. And now I turn 66, my COBRA coverage ends, and now I need to hop on Medicare. Well, what I do, this guy, right? COBRA is not credible coverage, so you have to be very careful in that when you have credible coverage, or when you lose credible coverage, that you enroll at that initial enrollment at age 65. So as I mentioned, the most common exception here is the special enrollment, which is when you didn't sign up for Medicare at age 65 because your group health coverage plan covered you all along the way. You had credible coverage. So once you lose credible coverage through your employer, you may sign up for Medicare there within your special enrollment period. Again, 3 months after you lose credible coverage, you have to sign up for Medicare. So think of that before. Medicare was 3 months before the month of you turn 65 and 3 months after. Very similar here. Think of the month you lose credible coverage as you're turning, quote unquote, 65, and then you have 3 months to sign up. I wouldn't suggest having any gap there. So I generally recommend for folks to have their Medicare plan, and whether it's their supplements or their Advantage or their Part D plans, picked out before they separate from service if they're allowed to do so. All right, I mentioned today is a special day when it comes to Medicare open enrollment. Every year, you have an opportunity to make changes. As we see some questions obviously coming in about kind of how Part D plans or Advantage plans, they can change their benefits every year. They can change their providers, they can change who's in network, who's out of network. And for example, what happens if your doctor was covered previously in your Advantage plan and now it's not, and you want to look for a different plan? So every year, think of it this way, much like when you were employed or have an employer, again, our here at Baird, our open enrollment to change benefits always is in the first part of November. Much like that, where you can change benefits based upon your change in life circumstances. You can add a Part D plan. You can add a gap policy. You can switch between policies. This happens in an 8-week open enrollment period that begins today and goes all the way up through December 7th. Think of this as folks who want to add coverage that maybe they didn't initially sign up for when they did sign up. So open enrollment starts today and runs through December 7th. All right, so how do we sign up? Surprisingly, there's a great website, Medicare.gov, that gives you a lot of great information on all of the different plans. Medicare.gov, if you haven't had a chance to go out there, it is one of the surprisingly well-ran government websites. You're able to get some really great information out there. What policies are available from both a gap and supplement and Advantage plan route within your area. You go out there, you put your zip code, you can actually see all available gap plans and Advantage plans that are there, and Part D drug plans that are available in your area. So by all means, you can also work with Medicare brokers. Medicare brokers, I always say, are much like travel agents. They're not paid by you. Oftentimes, they're going to be, most of the times, they're paid by the insurance company. So there's usually no added cost for you to work with a Medicare broker. If you have somebody you know and trust, by all means, great resources. Your financial advisor here at Baird, we have some connections and some resources that we have to help connect folks to Medicare brokers as well, if you're not really sure where to go from there as well. So, but if you feel comfortable with what you have, you know which route you want to go, you know which paths, you know which plans, and you want to do it on your own, you could definitely self-serve online at socialsecurity.gov. As much as the Medicare program is run by CMS, Centers for Medicare Services, Social Security is the traffic cop because your eligibility comes through very, very similar the credit approach of Social Security. You do also sign up for Medicare at Social Security, ssa.gov. Here's a little bit what you would need. You'd need obviously information on your Social Security number, where you're born, start and end dates. Again, if you are using a special enrollment period, they are going to want to confirm that. that you were covered under a credible coverage plan. Most often, your employer, once you retire, is going to provide you a statement if you are beyond the age of 65, stating that you were covered under a credible health insurance coverage plan until your date of separation. It'll have your name, your date of separation, and sometimes you're going to be required to provide that proof of credible coverage in order to sign up to not be assessed that penalty. So if you are separating from service beyond the age of 65, always worth clarifying with HR if they can provide you a copy of confirmation of credible coverage to make sure you can avoid any delayed penalties on your Medicare signups. All right, Ron, are you able to come back on screen and help with this one as well? I need a little bit of a breather on this one. I'm gonna call an audible.
Yep, I'm here.
All right, I'm gonna hand it back to you, Colin. I'm throwing an audible on this one here. But I just
We're talking about HSAs, my favorite topic.
Exactly.
Yes. All right, HSAs. So as financial planners, Matt and I love HSAs. These are the only accounts that you can contribute to and receive a tax deduction for the contribution. Then it grows tax-free. And then if you pull it out for an approved health-related expense, it's a tax-free distribution as well, often referred to as triple tax advantaged. No other account offers that. A great spot to put some money. In fact, what we often advocate is when you're eligible for an HSA, go ahead and contribute the maximum amount that you can, and then let it sit and pay any health expenses that you may have in that current year out of pocket, and let this grow to retirement. In fact, what's really cool is if you put so much in your HSA that maybe you have more money in your HSA than you think you might need for health-related expenses, you can actually take distributions out of your HSA for any expense you want to at the age of 65. Now, at this point, you're treating it as an IRA and you'll pay tax on the distribution, but you still have access to the money. Now, if it's for an approved health-related expenses, it'd be a tax-free distribution still. Really cool. And you can use these accounts for any qualified medical expense that's eligible for also a Schedule A deduction. Can't do both, but if it qualifies for a Schedule A deduction, you could instead take it from your HSA. Now, you can also use it for prescription drugs. We talked about the deductible with that, up to $597 in 2025. You can use your HSA to cover that. You can cover premiums, dental and vision expenses. Unfortunately, what you can't do is use it for Medigap premiums. Now, Matt and I know the winds out of Washington on many topics. This one we don't understand, so please don't ask. But you can't use it for Medigap premiums. Now, here's the other thing that you should be aware of as well. Let's say that you are working later in life. You've gone past your full retirement age for Social Security and you're still working and you decide, I would like to go ahead and collect Social Security, which you can do. And you can do it at that point regardless of earnings. But the problem is once you start collecting Social Security, you also automatically get Part A, whether you like it or not, from the federal government to you. Once you have Part A, you're no longer eligible to contribute to an HSA. It doesn't matter what your health insurance program is to work. So another pitfall there to be careful of. If you've contributed to the HSA when you had and you've been collecting Social Security as well, what you need to do is pull out the contributions and any attributable earnings. We can help you with that. Okay, so a couple things to be aware of. Another thing we're thinking about at Baird, so more to come in this department, but we find it very important that probably the most important thing about retirement are the goals you want to accomplish, the things you want to do. You stopped working for a reason because you want to do other things. The problem is if you haven't taken care of your health, that may inhibit you from being able to do some of those things, like spend time with your grandkids, because you're no longer fast enough to keep up with them. So keeping yourself healthy is really an important part of retirement. It's the most important part to be able to enjoy it. And so we're thinking about that at Baird, and we're coming up with ideas and thoughts and some leadership around this area. More to come here. I just mentioned financial planning an awful lot. And that's really our bread and butter at Baird. Understanding how all of the financial pieces, all the things that touch your life that has this dollar sign attached to it, how they all fit together to help you reach the goals we just discussed. It's something we're passionate about. So hopefully you're fully engaged with your advisor in relationship to financial planning. And they often call upon Matt and I and others as well to help in this regard. With that, Colin, are there questions that we can address?
I got a couple that we got here that can run through in the Q&A. Questions around underwriting on Medigap coverage. So the first time that you enroll in Medicare, the first time you have a 6-month initial enrollment period if you're going to be signing up for a gap policy. The first time that you sign up for a gap policy, there is no medical underwriting. It's guaranteed issued. Any subsequent changes after that 6 months, open enrollment, changing gap policies, if you're changing providers, you may have to go through medical underwriting the second time. Ron, anything you want to add on underwriting, pre-existing conditions, changing between policies?
Yeah, well said, Matt. Essentially, you can move from Medicare Advantage to Medigap and open enrollment. But there are 11 health questions you're going to have to answer in the affirmative to be able to do that. Essentially, the rules aren't going to allow you to wait until you're not healthy and when you're sick and then move into Medigap, which is a little bit more comprehensive coverage. But yeah, you've got it, Matt. We had another question come in. If I'm retired, can I start an HSA? Well, it's a good question, Joanne. And the answer is maybe. So if you're retired and you're under the age of 65 and you have a high deductible health insurance plan, now I don't believe marketplace coverage is going to qualify here, then you can contribute to an HSA. You can start an HSA. Once you're on Medicare at age 65, though, you're no longer eligible. Colin or Matt, you see any other questions that we can address?
If spouses are different ages, is there anything that should be considered by the first spouse? I'm presuming that's going to mean the first spouse that signs up for Medicare. And obviously, you have sort of that joint, one's on Medicare, maybe one's on the Affordable Care, or one's on gap coverage. Sometimes, again, depending upon the situation, depending upon your employer, sometimes you can keep a spouse even if you're working part-time or casually. So a lot of times the decision about when one person retires is trying to get the second person to 65 as well. So anything else that should be considered from sort of difference in ages there? The one thing with the person continuing to work, keep in mind the IRMA part, right? So that's an important aspect, is that IRMA, sometimes if you have 2 people working, the IRMA penalty we talked about is a per person penalty. So there are some planning aspects there. If there's only one person on Medicare and one person not on Medicare, if there are income items that you need to sell a home or something that you're going to create a large taxable event, it's generally better to do it when you only have one person paying that additional premium versus 2. So there are some considerations there in regards to different ages there as well.
Well said, Matt. We do have another question coming in. How does one find a good Medicare broker? It's a really good question. And probably the easiest way to do that is to reach out to your Baird advisor and we can get you somebody locally who can help sort through. I think some questions were Medicare coverage in Florida. We certainly can refer you to someone who can help you sort that out. There's several people that we trust in the area. So reach out to your advisor. If they don't have the names, we will certainly step in and help as well. We had another question. Does the VA medical coverage and Medicare work together? Yeah, oftentimes what we see is sign up for Part A and sign up for Part B, and then use the VA coverage as a supplement. But it's often a good question to ask the agent as well.
I think along those lines, I know I've seen a lot of state and federal employees who have kind of their own supplement plan as well. So again, these are state by state and even generally federal institution to federal institution. But when you think through a supplement plan or an advantage plan, they're oftentimes supplements, it's all about sort of the pool of people. And you'll see oftentimes, for instance, if I'm a state employee and there's 20,000 employees in the state and I'm an insurance provider and I can get all 20,000 of those people to go towards my plan, I'm usually going to give a little bit more of a preferential rate to that group than I would be to the one person who's signing up individually. So something to kind of keep in mind is sometimes you're going to see a lot of those state or federal or VA type plans that are going to offer their own Medicare supplement or Medicare gap policy. They're usually quite good. And usually, again, I think through it, because there's such a large pool, they're likely not going to be the ones that are going to be canceled or removed or pulled out of the marketplace if that happens.
Lots of questions coming in, Matt. I guess we're doing a good job. I can take the next one. If you own a home in a different state, is Medigap a better route to go? And the answer is maybe. I would say maybe even stronger than that, probably. The good news is with Medicare Advantage, networks have gotten very large because of consolidation in the industry. So it's likely that you could find a Medicare Advantage policy that offers networks in both locations where your two homes are. But obviously, if you have doctors and hospitals in both locations that accept Medicare, and you likely do, Medigap is also a very good option. Now we had another question come in. Can one make an annual contribution to an HSA the year they turn 65? Well, first of all, it depends. Are you continuing to work, not take Social Security, and stay on your employer provided coverage? And the answer is yes. If you're not going to work and you have coverage all the way up until your initial enrollment period, then yeah, you can contribute a prorated amount. I believe that is what you can do there. Matt, I'll tell you what, I'll throw this to you and then I can add to it. But if you're traveling abroad, how do you handle coverage?
Yeah. So some of those gap plans, when you saw, did have foreign travel emergency coverage, and it's usually about an 80% number. So I'm not going to go back to that slide, but you saw oftentimes many of the gap plans have that. So think of it this way: anything a gap plan or supplement plans, usually Advantage plans are also providing some level of that coverage, right? They want to be competitive in that area. However, if you're spending months in a different area and it's a different country where Medicare is not accepted, usually I would say that's probably where you want to get a short-term travel health insurance plan as a supplement to it. So some countries provide coverage, some countries do not. Again, so depending upon your familiarity with the country and their healthcare system, using kind of having those short-term 30, 60, 90-day policies are best as a way to fill those gaps when you're traveling lengthy. Ron?
Yep. That's perfect. Yeah, essentially, Medigap will offer enough coverage to get you home. So it's always something to consider to buy additional health insurance if you're traveling abroad. So well said, Matt. We had another question. Are there any books or online sources you suggest? And I would tell you that Matt mentioned Medicare.gov. He's also got the government resource there. I'll tell you the book I read to learn about Medicare, I thought was very good, was Get Yours from Medicare. If I can endorse a private author, but it was good as well. We had another question come in. HSA, do I have to wait until 65 to use for medical expenses and premiums, etc.? I want to retire at 64 and a half next year, and I have a sizable balance in my HSA. And the answer is no, you don't have to wait. You can access your HSA anytime you want to for an approved health-related expense. Now, if it's not an approved health-related expense and you're under 65, distributions will incur both an income tax liability plus a 10% penalty. Over 65, if it's not an approved health-related expense, it's just simply a normal distribution that would be ordinary income on your return. But to answer your question, sure, is yes, you can use it before age 65.
Are all premiums deducted from Social Security premiums? Any of the Part B premiums and IRMA are deducted from your Social Security. Part D and Medigap. I think Medigap, my understanding around it, is actually billed separately.
Yep.
So yep. It's not deducted from your Social Security. I'm trying to think on the Part D plan. If that's Social Security as well.
Yeah, just Part B is what you're going to see from Social Security. Once you start Social Security, it will be deducted from your Social Security payment. If you've started Medicare before you've started Social Security, don't worry, don't fear. The federal government will find you and you'll be billed for the premium. And that's Part B only, as in Bravo. Matt, do you see any other questions coming in? Colin, do you see any more?
A couple here. Let's see here. We got that one answered. Medigap Type F available in Wisconsin. F is now no longer available. I mentioned F plans after 2020 are no longer available. Wisconsin has its own separate plans that are not by the letter by the letter of the law, as I joke. They are separate plans. Reach out to us. We can talk through kind of Wisconsin separately. It's kind of its own plan when it comes to supplements as well.
Yeah, we got another one coming in, Matt. This is a good one. So all of our real estate is in the trust name. If we sell it and the proceeds stay in the trust, will it impact IRMA? And that's a really good question. And the answer, of course, is maybe. If it's a revocable trust, yes. The income will pass to you and be reported on your return. Now, if it's an irrevocable trust, which means it's a separate legal entity from yourself, has its own tax ID number, and is not a disregarded entity, it's possible that the trust will pay the tax liability. In that case, no, you won't be impacted by IRMA. But I will tell you, and Matt, you can probably back me up on this, the tax liability by keeping income in a trust would exceed your IRMA liability because of the compressed tax brackets associated with trusts. So something to be aware of. In that instance, we'd ask you to engage us separately, and we'd be happy to walk through with you what's the best course.
A couple of questions and clarifications on HSAs after the age of 65. Again, if you are not on Medicare, if you are still covered by your employer plan, again, you can still contribute to an HSA. The big thing you just remember is if you're going to sign up for Medicare within 6 months, you cannot be making contributions to an HSA. So you can be 66, 67, 68. As long as you aren't on Medicare, you can still make those contributions to an HSA. It's just once you start to contemplate and you get into those enrollment periods, that's when you can't be making those contributions to an HSA.
Let's see, another question here, Matt, is, let's see. I am 65 and plan to work until 66 and a half. When I declare my retirement date, is that when the special enrollment period begins? And the answer is no. It's actually the month of your retirement and then the following 7 months.
Question on SHIP or SHINE, also great resources. SHIP and SHINE. SHIP is SHIP. SHINE, shine like a diamond. SHIP, like SHIP Trails the Seas. State health insurance are also great resources above and beyond Medicare brokers. The difference, I would say, SHIP and SHINE are much like Ron and I, very great educational resources. They can direct you. They can't enroll you or sign you up, is my understanding. Which is where a Medicare broker can actually take you to the next step, which is to be able to actually sign you up for the plans that you agreed to as well.
And we have one final question. So one of our clients or participants is wondering if we have a recommendation from where to buy essentially travel insurance or global health insurance coverage. I don't have anything off the top of my head, but what I would do is reach out to your advisor, and we can do some research for you and see if we can find a decent provider. But I don't have anything. I'd have to look that up. So Colin, I think we've gotten to the end.
Yeah, definitely. And thank you again, Ron and Matt, for your contributions. And thank you to everyone who joined us today. We had some great audience participation, and you guys definitely kept Ron and Matt busy. We hope you found the discussion valuable and a worthwhile use of your time. If we weren't able to get to your question, or if you'd like additional information, please don't hesitate to reach out to your Baird contact who can connect you to the appropriate resource. For those interested in revisiting today's presentation or sharing it with others, whether a friend, family member, or colleague, the session has been recorded and will be available in approximately 1 week. You can access it through your Baird financial advisor or by visiting bairdwealth.com. If you're not currently working with a Baird advisor and would like to explore that opportunity, you can find an advisor near you by clicking the Find a Financial Advisor button on our website. A direct link will also be included in our post-event survey. Thank you again for joining us, and we wish you a wonderful rest of your afternoon. Thank you.